I am very happy to see that people are taking mental health more seriously these days. Um, Childhood traumas and things that we deal with now, anxiety, depression, so on and so forth. Um, People who don't have a lifelong illness also deal with that, but the people who do deal with their illness on top of all the regular things that we go through day in and day out of being human in society. As I was a kid, not telling my friends or not telling my classmates that I had sickle cell to avoid having conversations about sickle cell, something that they didn't probably understand, and I didn't make the effort to teach everybody about sickle cell. Um, when I was a kid in elementary school, I would miss class and I'd have friends ask me, "What's up? What's wrong?" This and that. I may have got it treated differently, but not to a point where it pushed me to an edge. But it all did build up. Um, Being outside at home, playing, games and stuff like that, there would be times where I wouldn't want to play, or I couldn't play, or I wasn't in the neighborhood at all because I was admitted in the hospital, and I'd have to come back and get asked 1,000 questions, and all of that stuff kind of takes a toll on you mentally. Not to mention all the things that you deal with in a hospital setting or in a medical setting in general. I also talked about how ER visits were a different beast all their own, dealing with nursing or doctor staffs who don't believe that you're dealing with these things, dealing with that for years, dealing with the excruciating pain on top of it, um, feeling like a burden to a lot of people, to my family majorly, because there was times where I had to wake my parents up in the middle of the night, scared, scared to go wake them up in the middle of the night, because I didn't want to bother them. They're asleep. They got stuff to do. But I'm coming crawling into your bedroom because I'm having a pain crisis. And I was fortunate, very fortunate to have a family that I do. Obviously, they were understanding. They never threw any of that stuff in my face. Like, I know there was times where they had to call off work or, things like that. Things that I recognize now as an adult that I didn't recognize as a child. But calling off work, possibly missing paychecks, having to deal with people being inconsiderate to us in the hospital, things of that nature, like the stress that they probably went through dealing with me and my illness. I didn't see that. I didn't even think about it until I became an adult, though. And I'm sure that was a lot of pressure on them as well as it was for me, being afraid to even tell them that I was having a crisis because I didn't want them to deal with me and my stuff, I just wanted things to be normal. But far from normal. Far from normal. And then obviously the liver transplant, things that I dealt with being in the hospital for 6 months straight. Everything from close to kidney failure to being on dialysis for 6 months to all types of other issues. Basically having cabin fever, becoming depressed, becoming anxious, being rude to the people who kept me alive, cussing people out. It was a lot going on mentally, and I felt like there's no one there for me. Mentally, there's nobody there for me. There's nobody who understands all the stuff that I'm going through. Yes, there's therapists they'll talk to you, they'll listen, but they don't understand your pain. They don't understand being in your shoes. None of that stuff. So it was a lot of times where I felt like there was no one to turn to. And even if I did see a therapist that the hospital provided, it probably wasn't the therapist that I needed. So there's even now, there's a lot of issues mentally that I know I need to get taken care of. But I believe that people who deal with lifelong illnesses or just an illness, period, something that makes you outside the normal, there should be people in place to help us navigate through our mental struggles. I don't know if there's things that we'll ever get over because you also have to deal with life itself. I'm not sure if there's ever things that I'll get over, such as making warrior friends and unfortunately them passing away at young ages. And here I am standing after a liver transplant. So then I started to feel survivor's guilt, like how how did they not make it through that? And yet I feel like my ordeal was a lot bigger, and here I am. You know, there was a lot of survivor's guilt, missing your friends on top of that. You know, it's a lot of difficult things. There's a lot of different avenues. Um, Hearing about warriors, especially with social media, I made a lot of warrior friends that are in different states and stuff like that, and then dealing with them passing, and you don't see their post on Facebook anymore. You know, it's difficult. It's really difficult to navigate, and yeah, you can probably see a therapist and they can help you out, but there's probably not gonna be somebody there for you to deal with the sickle cell side of stuff. You know, and I know that getting the right treatment for us with our pain crisis, or when we have to get admitted for any other issues, that stuff is just as important as us dealing with things mentally that we do. I feel like there should be some sort of therapy in place from childhood up until adulthood, somebody that you can also go see, just like you go see your hematologist, you know? So being a functioning person of society is one thing. Being a functioning person in society that deals with a lifelong illness on top of it is another. And that beast is incredible, and that beast needs uh, a family, and some very, very smart professional people to help deal with um, forever, honestly, because it's never gonna go away. So, as important as it is to go see a hematologist, however frequently you do, you should probably be seeing therapists as well, just to deal with the things that we deal with in our life as well.